I'm trying to start to talk to people right around that sort of nursing innovation phase, and also want to talk with them a little bit about nursing informatics or healthcare informatics, because that is just something I'm interested in, something I'm pursuing, and yeah, I think it's interesting. Hi friends, welcome back to my YouTube channel. My name is Brianna, for those of you who do not know me and maybe just hop on my channel and this is the first episode that you're watching. I'm a registered nurse doing my thing away from the bedside. And let me show you Bambi because she wants to be seen. Come here. Come here. On this episode, I'm looking forward to chatting with a nurse content creator that I've had the opportunity to collaborate with. I'll insert some of the reels that we did. But what I really like about this nurse content creator, who goes by the name of Mr. Ray Psych NP, is how he utilizes social media to provide education to his audience. He's a nurse practitioner in the mental health space. And what I really appreciate is his ability to get a very specific message across in such a short amount of time. So whether that is definitions or encouragement, or just things that nurse practitioners may need to know in their practice as a nurse in their specialty. So definitely stay tuned. If you think this is going to be a good discussion, leave a comment. Let me know what you think. Let me know if you found it helpful. And all right, let's get started. So, Mr. Ray, if you could first... Oh, by the way, thank you for taking the time out to speak with me today. I really appreciate it.
Most definitely.
So what I'd like to first ask you to do, if you could share kind of like your background as a nurse. You don't have to go too much into detail, but sure. How you started off, what got you into mental health? Was it always something that you were interested in doing? And a little bit about your practice.
Sure, no problem. So I actually started off as a firefighter paramedic. I did that for 14 years and then decided to get into nursing. And then the nursing really was a turning point for me as far as getting more in depth in critical care and also patient care. So I loved it so much. When I was in nursing school, I decided, hey, you know what? Maybe I should further my education. So they took us actually to sorry about that. They actually took us to a actual mental health facility. Went to the mental health facility and I fell in love with it. I mean, maybe I'm crazy a little bit. I don't know, but yeah, I fell in love with it. And then once I fell in love with it, I totally decided to go ahead and pursue the career. And when I pursued the career, I was like, hey, you know what? I'm going to continue this thing and educate other people once I get mine. Yeah. Decided to go ahead and further that into becoming a nurse practitioner at the same time. So, but I think I was pretty much destined to become a nurse practitioner, most definitely.
Really?
Yeah, I felt I had the vibe, you know?
Yeah, I love that. Did you have the vibe like before you went into nursing, or you kind of just found the vibe as you along your journey?
Well, I think for me, Bree, I think it was just mental health is such a stigma, right? And it was an untreaded territory, and not many people was doing it.
Okay.
But I think for me, the love of it became more when I started talking to the patients on my clinical rotations. And I said, you know what? I think I'm pretty good at it. I'm pretty good with words. And so I went ahead and said, hey, man, you know what? I think I could probably make a small impact, probably not much, but a small impact on getting mental health out there and assisting some of the clients that's dealing with mental health issues.
Okay. All right. Have you ever heard that saying, you got to be a little crazy to work with the crazies?
That's me.
That's
That is
you.
most definitely, yes. So
Okay.
I'll be honest with you, in school, my anxiety level used to be off the roof when they said, hey, you have an exam, right?
Yeah.
And I think for me, knowing that, I dealt with anxiety, test anxiety,
Okay.
uh, I wanted to find other ways to be able to handle it. And I did.
Mhm.
I did. I actually started studying in more quiet areas. I started using audio, and I think that reduced my test anxiety. So I
Yeah.
know if I can overcome anxiety, maybe I can show people how to do that, or any other mental health issues, and hopefully they'll be as successful as I have so far.
Absolutely. Um, you had mentioned how maybe you can make an impact. Maybe it's not a big impact, but
Yeah.
we don't have to do all these big, amazing things to feel impactful.
Right.
If there's something special that we have that we can share with others, just the fact that we can make an impact,
Yeah.
and be purposeful, that in and of itself, I think, is impactful. So,
That's good. Yeah.
which is a big thing, you know?
Yeah.
So, yeah, just
It
wanted to
is.
add
Ah. Well, thank you.
that. Yeah. All right. So, okay. So you said that you decided to become a nurse practitioner after realizing that you really liked working with mental health patients. How long did you do the nurse practitioner thing before starting your practice?
So it took me every bit of 6 years, 6 to 7 years. Um,
That was
as you know,
after you completed your degree?
yes. So, well, the degree it took 6 years to complete, but from regular nursing all the way to nurse practitioner.
Okay.
Yeah. Now, it took me after I graduated and got my nurse practitioner, got credentialed, it took me approximately 2 to 3 years to finally get my business up and going. For most, it probably wouldn't take that long. But me having a family and other obligations,
Of course.
you have to take your time and make sure everything is set just right.
Okay. And so this is your private practice, right? Your mental
Yeah,
health
yeah,
practice. Okay.
yeah.
When did you know it was a good time to start?
To start my own practice,
Yeah, despite,
well,
being busy with family and other obligations.
right. So I noticed that the scheduling for other practices. So I did start off with another firm when out of when I got out of school.
Okay.
But the thing is that when you're working with another firm, you have to meet certain quotas, and if you don't meet certain quotas, then there is a possibility that you could either be dismissed or you will have to end up finding another place to go. You see, so if you have a quota to meet, such as 20 patients a day, and you don't meet that quota for about I want to say 6 months, then you're going to get reviewed.
Mm,
You see,
yeah.
and a lot of it doesn't have to do with you per se as a clinician. It's actually it can also be the actual PR or the public relations that company may have, or advertisement that company may have, and they may have very little advertisement.
Yeah.
So I kind of got tired of walking on eggshells, and that's when I started to pursue my own clientele and decided to do something different.
And I guess that's with a lot of things,
Yeah,
and kind of how healthcare is set up in general. There's always some kind of metrics or quota that you have to meet.
Yeah.
But that's pretty serious. That where you were, if you did not meet a certain set of metrics for maybe 6 months, you could possibly get dismissed.
Yeah. They're going to review you. They're going to ask why your patients, why don't you have enough patients, and or why aren't the patients returning? And people have their own reasons. I think
Yeah.
the key thing is, as long as you stay on your A game as a clinician and you're doing what you're supposed to do, not being under review through your state or any of those things, you're going to be just fine. Even if you find another firm and not go into your own business, that's a possibility, and you may have better results.
Yeah. Yeah.
Yeah.
Okay. How long would you say for a nurse who is leaving the bedside, or maybe their specialty is mental health, right? And maybe they're working in an outpatient setting and they have not gotten their advanced degree or nurse practitioner degree as yet. Do you think they should be practicing as a nurse in mental health for a certain number of years prior to going for their NP or further degree in your specialty?
So I would totally advise anyone that's wanting to get into a certain specialty to work in it, whether it's acute care, geriatric care, mental health, right? Mm-hmm. So if you're doing mental health, you want to be in a mental health setting, so you'll be able to understand what mental health is about. And if you decide to, get your degree in practicing mental health, you want to like medications, things of that nature. You want to know what all that is.
Yeah.
Mm-hmm. So I think it's truly going to be advantageous for you to be in whatever field you're in, and you want to become a clinician or a provider. You need to know about that field.
Yeah. So at least like 2 to 5 years.
Most definitely. Yeah.
Okay. Because I had someone comment on one of my earlier YouTube videos, and this was a nurse who was very interested not only in mental health, but also in like technology or informatics. And so his question was, he was wondering like how long, should he probably be doing his mental health thing before transitioning or kind of combining the two or specializing. And so I guess for him too, 2 to 5 years would be, like you said, for anything. You want to maybe not become the biggest expert, but you want to become well versed in that specialty before you add on. So I think that makes sense. Do you use or any additional staff members in your current setting use informatics in any way? And when I say informatics, it's such a general term, right?
Right.
Informatics is basically just gathering data or gathering science, gathering information, analyzing it, interpreting it to make decisions, to make healthcare better. So even on a small level or complicated level, I was wondering, is informatics used in your practice?
Almost definitely, especially in the EMR aspect. There's always new ways to try to figure out, hey, what can we do to make our program better? What can we do to satisfy our customers a little bit more? And that's very important. That's very important as far as dealing with EMR and what it's producing for the client. Is it easy access for them to be able to put in their intake information?
Yes.
Things of that nature,
Yeah. So do you have like a patient app, patient portal?
Yeah. So right now I'm using onebehavioral.com. I'm using it right now. And what it'll do is you can actually choose from a list of providers, and that I'm one of those providers.
Okay.
And yeah, you can just go right into the website and you can request Mr. Ray. And
Okay.
yeah, they know exactly. But I don't want to get too many kudos, but hey.
Oh my goodness, this is great. I love it. I love it.
Yeah.
Okay, so they know that Mr. Ray Psych NP is the first choice in the app that they.
I wish it was. No, I'm like at the bottom. But yeah, if you look in there, you'll see Ray, and I'll just tell you my last name, Ray Finley. And once you put that in there, then I'll be your provider. So it's a pretty good thing.
All right, that's awesome. I love it. It's really nice to put a I guess talking face to the content that that I typically see. So it's almost like meeting someone pretty famous. I feel pretty privileged to be able to connect with you and have you kind of collab with me on my platform. I really appreciate it.
Bree, I'm going to be honest with you. I am honored to be here, and thank you for having me on. I'm far from famous, but I really do enjoy. I really do enjoy people and what I do.
Yeah.
And in the Ponca City Blackwell area, 68 degrees today.